Okay. The next question is, what are the causes of epilepsy?
So
Can you hear me?
let me come in. Yes, let me come in. So epilepsy is a situation where there's I'll call it an electrical malformation or physical malformation in the brain, where the activity, because the brain, you have the neurons that help to control how your brain functions, and sometimes they misfire. So when they misfire like that, then you can start having the symptoms of what we call epilepsy, where because the brain is what is like the what controls the rest of the body, tells you when you want to move your hand and how to do things. So when they misfire like that, then you start having what you call seizures. All right. So people with epilepsy will have recurrent seizures. So sometimes, and there are certain triggers. Sometimes it could be stress or anxiety. There are so many triggers or illness. And these patients, the brain misfires and then they start having, seizure-like activity or seizures. All right. Now, the epilepsy itself is a lifelong condition, which can be managed with medication or other factors. So if a patient has epilepsy, the patient will need to be seen by a neurologist. And when the patient sees a neurologist, they're going to do some tests, the first one is probably they'll do what we call an EEG to check the brain activity to see if there's misfiring in certain areas of the brain. And usually, if a patient with true epilepsy, there's going to be some area that is misfiring. After that, they might do an MRI just to see if there is a malformation, a defect in the brain that's causing this. And then based on this, epilepsy can be classified into different types depending on how the person presents. Some of them will present with falling out and having general shaking of the body, which is called generalized epilepsy. And some will have what we call partial epilepsy, where they might have symptoms, might not just have that generalized shaking of the body. It might be focal, where the one part of their body is moving or they exhibiting some kind of behavior, which you might not know, but they are epilepsy based on the classification. So you have the broad generalized epilepsy and the partial or focal seizure. So now, based on this, will determine there are so many medications that can be used to treat epilepsy. But you have to see your neurologist, and they're going to put you on the medication for the type of epilepsy you have. A lot of times, these medications are able to control the patient's seizures, and also there has to be lifestyle modifications. And there are certain things patients with true epilepsy cannot do, so because they can endanger themselves. Some of them are not allowed to drive because they could have a seizure while they're driving. That you can imagine that. So they'll put them on medication depending on the type of epilepsy, and hopefully their epilepsy is controlled by this medication. Some of them have to wear a neck bracelet that tells people that they have epilepsy. Now, in the case where these patients cannot be controlled by medication, you can do multiple medications. If this doesn't work, there are some surgeries that can also be done for these patients. So it's always important to diagnose epilepsy early, especially in children, because sometimes children might not present the way an adult will present with epilepsy by shaking. A kid might just be, my mom might come in and say, my kid is always blinking. Every time my kid is blinking, I'm not doing anything. That kid is probably might be having a seizure. The only thing the kid is doing is just blinking. Every time I'm looking at her, she's just blinking and not responding. And that is very dangerous because if that kid is not treated early and diagnosed early, that kid will end up with permanent brain injury. So it's always good, especially in childhood, to diagnose epilepsy early to prevent long-term brain damage, which can affect the child for life. And of course, after it's been diagnosed, well, most of the time they're going to present to the ER or to their primary care physician, and from there, the next thing that they are referred to a neurologist, where they get the necessary imaging and the seizure characterized, and they started on the appropriate treatment. But very important that it's diagnosed and we know the signs of seizure, especially in children.
Thank you for that. And